If you or someone you love is navigating an ALS diagnosis here in Pennsylvania, you're probably looking for clear, reliable information about every single option out there that could help improve quality of life. Well, that's exactly what we're here to do. In this explainer, we're going to provide a straightforward guide to understanding medical marijuana as one of those options.
Just imagine hearing those words. For so many people facing ALS, the path forward can feel incredibly narrow, and you're often left trying to manage a whole host of really difficult symptoms on your own. It's a moment that can feel so isolating, so helpless, and honestly, it's that reality that brings us here today.
So let's get right to the most important question you probably have. The answer is yes. In Pennsylvania, ALS is officially on the list of qualifying conditions for a medical marijuana card. This means it's a completely legal and accessible option, and now we're going to dive into what that really means for you. To really get why this matters so much, we have to start by acknowledging the tough reality of this disease, and then look at how Pennsylvania's program is specifically set up to help.
So what exactly is ALS? At its core, it's a disease that attacks the body's entire command system. Think of motor neurons as the messengers that carry signals from your brain to your muscles. ALS systematically breaks down those messengers. And as they're lost, the brain just can't control voluntary movement anymore.
And that brings us to the day-to-day burden of ALS. It's so much more than just the loss of movement. Patients often deal with constant pain, really debilitating muscle stiffness, a dangerous loss of appetite, and, of course, profound anxiety and depression. These are the specific challenges where medical cannabis often enters the conversation.
Okay, now let's talk about the science. It's so important that we approach this honestly. What does the research actually say about cannabis for ALS? And just as importantly, what are the limits of what we know right now?
This isn't just some random guess. There's a real biological reason why this connection even exists. Your body has something called the endocannabinoid system, or ECS, and a key part of that system are receptors called CB1. Here's the crucial part. These receptors are packed into our motor neurons, the exact same cells that ALS targets. It's like our body is basically pre-wired to interact with cannabinoids right where the disease is doing its damage.
So, it's really important to look at the human data with open eyes. The most solid recent study we have from the University of Texas Health Science Center in 2024 gives us a really nuanced picture. The evidence looks pretty strong for things like short-term pain relief, boosting appetite, and easing anxiety. But, and this is key, in that same study, the data didn't show a significant link for improving muscle spasticity or insomnia. Being transparent about this is the only way to set realistic expectations.
With that research in mind, how do we actually apply this stuff in the real world? This section is all about using this tool effectively while being super aware of the critical safety risks.
Okay, please listen very, very closely to this part. This is probably the most important safety message in this whole explainer. If you or your loved one takes Riluzole, the main medication for ALS, you absolutely have to know this. CBD can slow down how your body processes that drug, which could lead to higher, potentially unsafe levels in your system. This doesn't mean you can't use it, but it is an absolute non-negotiable reason to talk with your neurologist before you start anything.
Choosing a product isn't just about what's in it. It's about how you take it. For many people with ALS, things like oils, tinctures, and skin patches are often the most practical choices. They offer precise, long-lasting doses without needing complex motor skills or putting any strain on the lungs. And please, pay attention to that last warning. As soon as respiratory function becomes a concern, vaporizers and anything inhaled should be completely off the table.
Okay, so the science is starting to make sense, and the options are a bit clearer. Now for the big question. How do you actually get into the program? Let's break down the practical steps to make this whole process feel way less intimidating.
For so many patients, especially as ALS progresses, the caregiver is absolutely essential. And Pennsylvania's program is built with this reality in mind. A designated caregiver can literally handle everything, from sitting in on the online doctor's appointment, to filling out the state registration, to actually going to the dispensary to pick up the medicine. This ensures that access is never a barrier.
And the process itself, it's actually refreshingly simple. You can really break it down into just 4 steps. First, you get certified through a quick telehealth call with a registered doctor. Second, you or your caregiver registers on the state's website. Third, the caregiver does their part of the registration. And finally, and this is great, you get immediate temporary approval to visit a dispensary. It's really that simple.
So, we've covered the why, the what, and the how. Now this last part of our explainer is all about bringing the focus right back to you and the personal decision you're thinking about.
Let's end on what might be the most important takeaway of all. Medical cannabis is not a cure for ALS. There's no evidence right now that it slows the disease down. The goal here is totally different. It's all about managing symptoms. It's about using a legal, available tool to try and improve quality of life, to make the incredibly hard days just a little more bearable.
So after looking at the science, the risks, and the practical steps, it really all boils down to this one question. Based on your unique situation, your symptoms, and your life, is this a tool that could potentially improve your quality of life or the quality of life for the person you care for? The decision is yours. And now, hopefully, you have the information you need to make it.